Far too many people are denied their rights. We have consistently high levels of stigma and discrimination, which seem particularly resistant to change. We are now increasingly aware that people can die up to 20 years younger. People living with mental health issues can die up to 20 years younger than people who don't have mental health issues, more likely to be living in poverty. You'll have far fewer opportunities than people who don't have mental health issues, and that's not because people aren't interested or keen to do things. It's because the opportunities that are available are not tailored, they're not fitted to the needs of people with experiencing significant issues.
Well, the Declaration is a series of statements about rights and mental health in Scotland, and many of these rights already exist. They're either enshrined in international law or national law, but in our experience and in the experience of the many hundreds of people we've spoken to, having the rights there is not enough in itself. People need to be aware that they exist, and they need to be aware of how to claim their rights to allow them to have a fulfilling life.
The Declaration is about informing people about what their rights are. But it's also about letting people see where they think there might be some gaps between what rights they feel they have and what their rights actually are, and about beginning to close some of those gaps.
Well, the Declaration is accompanied by what we call the change agenda, and that really is about saying how are we going to make the difference, as you said, how are we going to make sure that these rights can actually be realised. So, for example, one of the areas that people say their rights are infringed at the moment is around accessing help and support, and one of our asks in the change agenda is that we take a kind of quite a fundamental look at the way that our service and support systems operate, because many people are finding it increasingly difficult to get help at all, or they're having to wait too long to get help.
It's been a massive consultation process over the last 8 months or so. We've had many hundred people have contributed, either online consultations or in the events we've had, focus groups as well. So what we've tried to do as a steering group is to take all of the ideas generated by all of that discussion and boil them down to the 8 key articles in the agenda. It's back to the principle of nothing for us without us. You know, we are the people who live with these conditions day on day. We know what the restrictions are, what the issues are, what the effects on our life are. And unless we are part of designing the solution, then it's simply not going to work. Moving to a human rights approach means saying, actually, we have rights. Actually, we have rights that need to be realised. And actually, that means people in power need to listen to us.
In my own instance, I've been subjected to discrimination as a result of my mental health history in relation to things like employment, physical health care, and other daily walks of life that I believe people who don't have a mental health diagnosis wouldn't be undergoing the same sort of discrimination, and it's time to change. I think having the declaration should make health boards and mental health professionals more accountable for the decisions and the actions that they make, and staff at ward level and at community level. They will be more accountable for the actions and decisions that they make, and they'll have a degree of responsibility as well in informing patients and carers of what their rights are and how they access those rights, and not assume that everybody knows that they've got rights and how to access them.
We want to see people's rights in Scotland being realised, the rights of people who are experiencing mental health problems and people who care for them to be realised in such a way that they can recover, they can live a fulfilled life, their opportunities to engage, to take part, to participate, their voices to be heard are very much part of everyday life in Scotland.